Good morning to one and all present here. Today I'm going to talk about the detection of micrometastasis in regional lymph nodes of oral squamous cell carcinoma. Our paper includes the background, literature review, problem statement, need for the study, aim and objectives, methodology, results, discussion, future scope, original contribution, conclusion, as well as the references. Now let's come to the background. We know that it's extremely important for us to detect as well as stage the micrometastasis in regional lymph nodes of oral squamous cell carcinoma, as the entire treatment plan depends on it, as well as the 5-year survival rate. We know that the 5-year survival rate is 75% without metastasis, 50% with metastasis in a region above the clavicle, and 25% below the clavicle. We also know that the Pap stain is an extremely valuable stain in detecting metastases, which are routinely missed in hematoxylin as well as eosin. Now let's come to the literature review that was done prior to the study. We have seen that in various studies conducted in which the detection of micrometastasis was done using immunohistochemistry as well as the RT-PCR. Both of them proved to be very expensive as well as time consuming, hence making it unreliable for the general public. Another study done in 2018 by Kirti Narayan using special stains such as toluidine blue showed us that it was not very effective in detecting micrometastasis in comparison to the routine H&E stain that was done. The problem statement. We have seen in 21% of the cases, micrometastasis goes undetected in routine H&E, and advanced imaging techniques are very expensive. Therefore, both of it is very unreliable and not very feasible. This leads to incorrect staging of the tumor as well as reoccurrence, therefore affecting the overall prognosis of the disease. Therefore, we need a suitable and a very special stain to detect micrometastasis rather than the conventional H&E. The need of the study is that in advanced methods such as PET scans, MRI, IHC, which make it very expensive and cannot be used routinely, whereas our study is extremely simple yet very effective in detecting occult metastasis of the lymph nodes in oral cancer by adopting the Pap stain. This helps in accurate diagnosis and the treatment planning, decreasing the entire morbidity as well as the mortality rate. The aim of the study is to evaluate micrometastasis and individual tumor cells in regional lymph nodes of oral squamous cell carcinoma by the Pap stain. Objective number 1 is to stain the metastatic as well as the non-metastatic lymph nodes with Pap stain and to detect the tumor cells in Pap stain lymph node sections. Now let's come to the methodology of the study. The entire biopsy is processed. First is the fixation, then is the dehydration, clearing, infiltration, as well as embedding in paraffin blocks. Once it's embedded in paraffin blocks, it is then stained using the Pap stain kit. The principle of the Pap stain is that the hematoxylin stains the nuclei blue, orange green 6 is a cytoplasmic stain which stains matured as well as keratinized cells, eosin azure gives it a pink color to the cytoplasm of mature squamous cells, and light green SF stains the cytoplasm blue. Pap stain demonstrates key morphological features associated with keratinization compared to the H&E stain. It also specifically highlights the tumor cells, which differentiates it from the H&E stain. Now let's come to the results. We have seen the histology of the normal lymph nodes, where we can very well differentiate the germinal centers as well as the perinodal fat tissues, and the capsule is very well differentiated using the Pap stain. Now this is the histology of a metastatic lymph nodes where the tumor keratin pearls are seen invading the lymph nodes, therefore differentiating it from what a normal histology of the lymph node shows. The normal lymph node stained with Pap shows us the germinal centers very well as the adipose tissues as well as the blood vessels. Now this is the metastatic lymph node stained with conventional H&E. Here we really can't see the tumor cells very well. It's not very well differentiated and not very well highlighted in comparison to the Pap stain. Here now the metastatic lymph nodes stained with PAP shows us the keratin pearls as well as the tumor cells highlighted in bright pink, hence differentiating it and making it go unnoticeable. Now these are two slides that are kept side by side, one that is stained by H&E and the other one stained by PAP. In the PAP stain, we can see that the tumor cell is very well differentiated and will not go unnoticed by the pathologist. Whereas in H&E, the tumor cells aren't very well differentiated and a pathologist may miss it during the detection of the metastasis. Examples of large tumor islands in metastatic lymph nodes stained with PAP. Here it appears dark pink in color, hence differentiating it and recognizing it very well. These are few other examples of individual tumor cells in metastatic lymph nodes stained with the PAP stain. Now let's come to the statistics. Now the statistical results were obtained using a chi-square, where we see that the p-value shows that the PAP stain is statistically more significant than the normal H&E stain. The PAP stain even highlighted a small foci of epithelial differentiation by imparting like an orange to a pink color to the cytoplasm of the metastatic epithelial cells. Hence, PAP was found to be more superior than the H&E in detecting tumor metastasis to the lymph nodes. The detection of metastatic lymph nodes is extremely critical in diagnosis as well as staging of the cancer. This affects the entire treatment plan and the prognosis of the disease. Therefore, we have used a very simple yet reliable method in successfully detecting micrometastatic deposits in regional lymph nodes. It has an advantage of being inexpensive, easily available, routinely used, more sensitive in identifying micrometastatic deposits. We have 18 metastatic as well as 18 non-metastatic lymph nodes, 10 H&E controls, and PAP stain had significantly higher capability in identifying tumor metastasis, hence making it a very reliable marker in comparison to the other special stains. The detection of even a single micrometastasis has a significant role in the prognosis, reoccurrence as well as the survival rate of the patient. Using PAP to stain and to detect the metastasis in previously undetected lymph nodes can change the entire histopathological grading of the carcinoma, therefore altering the treatment plan in terms of surgery as well as adjuvant therapies, without which we may treat the patient differently, which later results in reoccurrence and decreases the survival of the patient. We can, after staining the entire biopsy and seeing it under the microscope, we can validate these findings with cytology, RT-PCR and correlate it with the current study. This decreases the entire cost of the diagnosis and makes it very affordable for the general public. Through our study, we have adopted a simple yet very reliable and an economical method of detecting micrometastasis to lymph nodes using the PAP stain. This detection of PAP showed that how it can severely affect and impact the oral squamous cell carcinoma staging, which in return affects the treatment as well as the management strategies. This was our original contribution. Now let's come to the conclusion. I would like to conclude by saying that special stains like modified PAP stain is very valuable and sensitive in detecting micrometastasis over routine H&E stain. The detection of micrometastasis in oral squamous cell carcinoma patients is advantageous for the patient as it modifies the entire treatment plan in terms of radiotherapy as well as chemotherapy. I would like to thank our Dean, Dr. B.V. Srinivas Murthy, our Associate Dean, Dr. Kavita Prasad, our mentors, Dr. Soumya, as well as Dr. Dominic, and our statistician, Dr. Abha Singh. These are the references. And I would like to thank you for this wonderful opportunity for letting us showcase our study at the conference. Thank you so much.